so my topic is the use of marijuana in medicine. Marijuana refers to the whole plant rather than just the specialized parts that have been studied and have resulted in being seen to treat a range of illnesses and symptoms. The chemicals that marijuana produces, the most common ones are THC and CBD. THC is what causes the high, but it has been seen to increase appetite, reduce nausea, decrease swelling, and actually help muscle control. CBD, on the other hand, is not popular recreationally, and it has been seen to reduce pain, control seizures, and actually help in mental illnesses and addictions. So this is my power map so far. Obviously, I don't have much information on insurance companies yet, and I have to add manufacturers of drug manufacturers because insurance companies actually won't cover marijuana. As I have just recently learned, insurance companies will only cover prescription drugs, and because marijuana is still a Schedule 1 controlled substance, meaning it has a high dependency and no medical use, doctors can't really prescribe it. They can suggest it, or yeah. So although there have been about 3 pills that have been approved by the FDA and have actually been manufactured, I am not sure whether or not the insurance companies or manufacturers would charge insurance companies, or if insurance companies would gain anything from that. So that's something that I have to do more research on. But as you can see, I think the biggest proprietor in the use of medical marijuana is the federal government. Well, the federal government obviously has a bunch of branches that would give them information. So one being the FDA, the Federal Drug Association, the Food and Drug Association, and the NIDA. It's the National Institute of Drug Abuse. So all of those factors kind of give information to the federal government, which then goes through Congress, and Congress decides whether or not they pass the legislation to approve the use of medical marijuana. But it's not that straightforward. The federal government kind of gives this information to the state government. The state government is ultimately the proprietor of whether or not that state will allow the use of marijuana. Right now, only 34 states allow it, and yeah, but although the states have a say in whether or not they want to allow it, the U.S. Department of Justice, that falls under the federal government, also has a right to change or challenge the state's decision. Let's go through my power map now. The state government allowing the use or not has power over the creation of dispensaries, and the creation of dispensaries allows patients to have access to CBD or THC. The state government also has hard power over the patients because they are the ones who decide, and patients really can't do anything because it is an illegal drug still. They really have no say in whether or not they should allow it, except for participating in research programs and etc. Okay, so state government has direct correlation to whether or not it can be used, and that obviously affects the patients. Doctors, as I said before, doctors can't prescribe marijuana from what I understand because it is a controlled substance and it's only Schedule 1. So doctors do have hard power because they ultimately decide whether or not it would be helpful, but they don't really have, other than research doctors, they don't really have much of an effect on the federal government. And doctors have low effect on insurance companies because insurance companies hate negotiating, and insurance companies obviously have high effect on doctors if those 3 pills that I specified earlier do fall under the category of prescriptions that they would cover. So yeah, so insurance companies have little to no power over the federal government simply because they don't like to negotiate, and the federal government obviously has agencies that look over the insurance companies. So yeah, that is all I have right now, and I will be looking into what kind of power insurance companies have and whether or not those 3 pills are considered prescriptions or not, and how patients would be able to get them. Thank you.